Um, Bismillahirrahmanirrahim. Quote of the day: on that end you will be brought to the judgment, and none of your secret will remain hidden. I'm Dr. Iqbal, PGR Community Medicine, presenting under the supervision of Professor Dr. Saira Afzal, IPH Lahore. Today, the topic of presentation is health and healthcare system. Learning objectives are public health system, components of public health system, healthcare system, public and private sector organization, types of healthcare system, mixed health system, and healthcare system in Pakistan. So, first of all, definition of health according to WHO, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, a positive multidimensional concept, physical, mental, social, and well-being, and social, spiritual well-being. Health is the outcome that a health system exists to protect, promote, and restore. Health system, according to WHO, all organization, institution, resource, and people whose primary purpose is to improve health. It includes formal health services, which is public and the private, and health-related action outside them. So the ultimate goals are improved health, responsiveness, financial risk, and protection with fairness. Next is the public health system. It is the organized community effort through the application of medical, social, and the management sciences and aim to protect and promote the health of the population as a whole. So it should be the population focused concern with the health of the whole community and the population, not just the individual patient. Preventive orientation, which emphasize primary prevention, health promotion, and protection over treatment alone. Multisectoral, draw on medicine, epidemiology, sanitary engineering, and social sciences and management. Government-led society-wide, which led by the state, but implemented through the community, private, and the voluntary participation. Next is the administrative levels, which are the three administrative levels. First one is the central, the national level, which include the Ministry of Health develops and recommend health policy for the entire country. Administrators, national program, national training institution, and the national hospital that provide completed tertiary care. Second one is the provisional level, provincial health department implement the national policies and program. Provisional health hospitals receive referral from the local healthcare facilities and the conduct regional training for the local health professional and the volunteer health worker. Third one is the district level at the local level, which implements the national and the provisional program at the grassroots. For example, maternal and child health program, vaccination campaign through the referral hospital and the health center. So this is the pyramid of public health. First one, the base of the pyramid is the community participation, which include the grassroots involvement, the planning, delivery, and sustainability of the health program. Next one is the district, which is the referral hospital and health centers. Next are the provincial level, which is the health department and the regional training center. And the top of this is the central level, which is the Ministry of Health, National Center Program, National Hospital, and universities. So the core functions of the public health are assessment, policy development, and insurance. So the assessment are the systematic collection, analysis, and dissemination of the information on the health and the community. Surveillance, monitoring health status, identifying the health problem and hazard. Policy development by using the scientific evidence to develop comprehensive public health policies, setting priorities, mobilize community partnership and resource to solve problem. Assurance, assuring that essential agreed upon the service that are actually provided to the population, enforcing law, regulation, evaluating effectiveness, and guaranteeing a competent workforce. Next, the essential 10 essential public health services. Under the assessment include monitor health status to identify the community health problem, diagnose and investigate health problem and hazard, evaluate effectiveness, accessibility, and equality of service. Under the policy development, inform, educate, and empower people about health issue, mobilize community partnership to identify and solve problems, develop policies, plan, and that support health efforts. Uh, Assurance, enforce law, regulation protecting health and safety, link people to need personal health services, ensure a competent public health and the personal workforce, research for the new insight and innovative solution. So next are the components of the public health system. So the WHO health system building block framework, a widely used model, WHO 2007 describing the six interlinked component of the any health system oriented toward better health outcome. So it includes service delivery, health workforce, health information system, medical product and technology, health financing, leadership and governance. So why this framework matters? It provides a common language to describe, analyze, and strengthen the health system. All six building blocks must function together. Weakness in one undermine the others. Ultimate goal is to achieve these blocks to improve health, equity, responsiveness, protection from the financial risk and efficiency. So it is used by WHO and the health ministries. Other core components of public health practice include environmental health, communicable disease control, maternal child health, nutrition services, health education and promotion, occupation and health, school health, public health legislation, public health laboratory services. So next we will discuss the healthcare system. Uh, it is a health organized network of institutions, personal resource and activities whose primary purpose is to deliver personal that include curative, preventive, promotive, rehabilitative health services to the individual. So the public health system focus on the population and community as a whole. Its approach is mainly preventive and promotive. For example, immunization campaign, water chlorination. Whereas the healthcare system focus on the individual patient, so it approaches mainly through curative and rehabilitative plus preventive. For example, a patient being treated for the pneumonia in the hospital. Next are the levels of the healthcare delivery, which are the primary, secondary, and the tertiary. Primary is the first point of contact, which include BHU, RSC, dispensary, and general practitioner. Health promotion, prevention, and common illness care. So it is a community-based, most accessible, and high coverage. Secondary care is a district level referral care, which include DHQ, DHQs, hospital with the specialist services. It receives referral from the primary level. So the basic facilities that are available include medicine, surgery, gynae, and peds. Tertiary care, which is the specialized care, include tertiary hospitals and specialized institutions, complex investigation, subspecialty, and ICU care. So it is the apex of the pyramid, research and training. Referral flow from the primary, secondary, and the tertiary, and then feedback and the flow up, follow-up flow back downward. So the base is the primary care, which include BHU, RSC, and dispensaries, secondary care, and then the apex is the tertiary care. Next is the public and the private sector organization. Public sector organization, health organization that are owned, funded, and is administered by the government at the federal, provisional, district level, finance mainly through the taxation. So the key features include mandatory to ensure equitable access for all citizens, regulate and set standard for the entire health system, provide services often free and highly subsidized cost, accountable to the public through the government structure. Example include ministries and the Department of Health. Government hospital include DHQs are teaching hospital, primary care facilities which include BHU, RHC dispensaries, regulatory council, for example, medical nursing council, drug regulatory body. Vertical programs, which is the EPI, TB, malaria, HIV/AIDS control program, health regulatory bodies, which include public health, engineering, and food authorities. And next are the public sector, which is federal or the national level, include the Ministry of Health Services, Policy Planning, International Coordination, Vertical Oversight Provisional and the state level, which include the teaching hospital and tertiary hospital, district level, THQ, DHQ, RHC, disease surveillance and district planning, and then the primary level, which is the BHU sub-center lady health worker program. Next is the private sector organization. So the private sector organization owned and operated by non-government entities, individual campaigns, companies or non-profit programs, financed by the fees, insurance, other donation. Key features include driven by the patient choice, fees, and profit motive. provide a large share of outpatient curative care in many low middle income countries, variable quality, cost, larger and regulatory in some settings, complement and extend the reach of the public sector. So the categories that are of the private provider include for non for profit private hospital, clinic, individual practice, pharmacies and diagnostic labs. Cooperative or the commercial include private health insurance companies, pharmaceutical companies, and medical device companies. Not for profit, which include NGOs and NPOs, charitable hospital and trust. For example, AZ, Shaukat Khanam, Aga Khan. Faith-based organization, mission and religious charity, hospital and clinics. Informal, the traditional sector, traditional healer, hakim, homeopath, and unregulated practitioner. So the two structure within the private sector, the for profit and for not for profit. For profit include private hospital, clinics, and other health centers include the traditional medicine practitioners offering the health services as a business. Not for profit NGOs and philanthropic grants largely focus on the poor and marginalized, complementing the private sector role in social safety net. So the strength of the NGOs are technical expertise, specific program related technical expertise, outreach advantage, non-facility program approach, community distribution channel, and mobile health unit reach marginalized group. Many NGOs potentially target the group that do not traditionally access the service. For example, people living in the HIV/AIDS, service of drug abuse or the sort. Community leadership and public-private partnership potential. So the public-private partnership certificate program assess NGOs potential and help build the public-private partnership. Next are the limitations of the NGOs. It is a resource constraint, non-comprehensive mechanism, and funding sustainability at the risk. So next, the performance of public versus the private delivery. Public sector merits are more reported efficiency and accountability. Demerits include more limited availability of the equipment, drug, and trained worker. Whereas the private sector merit include greater reported timelessness and hospitality to the patient. So the demerits is more frequently violating medical standard of the practice and poorer patient outcome, less efficiency due to the unnecessary testing and treatment. So this is the comparison of the private and the public sector. The ownership of the public sector is the government, which include federal, provisional, and the local, whereas the private sector include individual companies, trust, and NGOs. Financing through the taxation government budget in the public sector, whereas in the private sector, out of the pocket fees, private insurance, and donation. Primary goal of the public sector are the equity, population coverage, and prevention, whereas in the private sector, patient service, open profit, and mission driven. Accessibility, public sector is a wide geographic reach, low direct cost, whereas the private sector is concentrated in the urban areas, most it is cost varies. Regulation in the public sector sets and enforce national standard, whereas in the private sector regulated by the government compliance variable. Perceived quality variable and resource constraint in public sector, whereas in the private sector often perceived as a higher amenity. Accountability, public and the primary accountability, private sector market and the professional body accountability. Next are the types of healthcare system. For classical model of healthcare system, which include beverage model, financing through the government and the provides care. For example, in UK and Spain, with smart model, employer are the employee funded, non-profit insurance fund. For example, in Germany, France, Japan, and Belgium. National health insurance model, single government run insurance, private provider. For example, in Canada, Taiwan, and South Korea. Out of the pocket are the private insurance, direct payment are the private insurance dominant. For example, in USA, low middle income countries, including Pakistan. The mixed health system. In reality, the virtually no country uses a single pure model. A mixed health system combines elements of beverage, Bismarck, and national health insurance are the out of the pocket model within a one country, often vary by population group or service type. So it is the pluralistic financing, pluralistic provision for population segmentation and evolve over time. Why countries adopt a mixed system? So the no single model can be implemented at all, especially in the resource constraint setting. It is a historical development, political economy, and the pragmatic pathway toward the universal health coverage, expanding coverage gradually, allow using private capacity to fill a public sector gap in the underserved areas. So next we will discuss the healthcare system in Pakistan. Healthcare system in Pakistan since the 18 Constitution Amendment 2010 has become a largely provisional subject. Pakistan now run a mixed pluralistic health system combining devolved public services, a large private sector, NGO and social health insurance. So it is the devolved governance. Provinces primarily responsible for the service delivery, three-tier public delivery, which include primary, secondary, and the tertiary, plus the lady health worker program, large private sector, eliminated to provide the majority of the outpatient consultation nationally. Expanding social insurance, Sehat Sahulat program, government funded health insurance, extended coverage for the hospitalization. So this is the healthcare delivery system in Pakistan, which include the public and the private sector. Public sector further divided into federal government and the provisional government. Provisional government include the provisional department and then primary, secondary, and tertiary level. Whereas the federal government include the Ministry of Defense and the ministries. Ministry of Defense, further military hospital and the whereas the research ministries include a research institution, hospital, and the vertical program. The private sector include a major hospital, including GP practitioner, Hakims, homeopathic NGOs, philanthropic organization, and traditional healer. So this is the same public health sector structure which we already discussed, in which the primary level include the BHU, RHC, and Lady Health Worker Program. District include the THQ and DHQs. Provisional level include the health department, which include tertiary and teaching hospital, and the federal level, Ministry of National Health Services and regulation and coordination. So next, the private sector key challenges in Pakistan range from single doctor clinic and pharmacy to the large cooperative and tertiary hospital provide a substantial share of the outpatient diagnostic services nationwide, include major charitable and NGO hospitals, largely unregulated in many areas, increase engaged to the public-private partnership or facility management. So the key health um, system challenges include persistently low public health spending relative to need, urban rural inequity to access to skilled care, high out-of-the-pocket expenditure, shortage and the maldistribution of the trained health worker, double burden of the disease, infectious disease alone, rising NCDs, fragmented data, health information system, weak regulation and quality assurance of the private sector. So Pakistan reform and the way forward, the strength of the primary health care, which revitalized BHU, RHC, and Lady Health Worker Program as a foundation for the UHC, expand social health insurance, improve health information system, integrated provisional data system, DHIS2, and similar for the real-time decision making, regulate the private sector, strengthening the licensing, quality standard, and fixing the oversight of the private provider, address the workforce shortage, increase production, rural retention, incentives, and skill mix optimization, and tackle the double disease burden, sustain the communicable diseases control by scaling up the NCD prevention and screening. So next is the recent update. This is an article which is published in 2020, which shows the healthcare system and its challenges in Pakistan. So the according to this paper, Pakistan is the underdeveloped country and it stands 65th position among the 102 developing countries. It has totally taken inherited healthcare system from the British side in 1947. Now the healthcare system consists of the private and the public sector. So the private sector served nearly 70% of the population, whereas the 30% of the population is served by the public sector. So according to the Constitution of Provisional Health of the, Pakistan, it is the government responsibility to provide the health facility to its citizens. So next we will discuss the MCQs. MCQs number 1, a district health team noticed that the incidence of dengue has increased over the last 3 months. The systematic collection, surveillance data, analyze trend, identify high risk areas, disseminated the finding with core public health function is primarily being performed. So C is the right option assessment. Obstacle number second, a professional health department develop a policy requiring all districts to strengthen dengue vector control activities based on surveillance finding which core public health function is best represented. A assessment, B policy development, C insurance, D rehabilitation, E clinical care.
B.
Yes, B is the right option. MCQ number three, a government identify that essential maternal health services are not reaching remote communities. It established mechanism to ensure availability of trained staff and evaluate whether services meet required standards. The activity primarily present A assessment, B policy development, C assurance, D health promotion, E disease surveillance.
A.
B.
Yes, C is the right option, assurance. MCQ number four, a country want to strengthen its health system. It identify weakness in health workforce, financing, medicine information system, governance, and health service delivery. Which framework best describes six areas? A, primary health worker, healthcare framework. B, WHO system building blocks. C, epidemiological triad. D, Ottawa charter framework. E, social determinant framework.
B.
Yes,
A.
B is the right option. No, B is the right option. WHO health system building block. MCQ number five, a patient with a complicated neurological disorder is referred from DHQ hospital to the teaching hospital for specialized investigation ICU management. This referral system represents A, tertiary level care, B, primary level care, C, community level care, D, secondary level prevention, E, home-based care.
A. D.
Yes, A is the right option. MCQ number six, a rural population receive basic preventive and curative services through the BHU, RSC, while complicated cases are referred to the higher hospital. Which principle is best illustrated? A, centralized healthcare delivery, B, referral based, three-tier healthcare, C, exclusive private healthcare, D, tertiary first healthcare, D, E, out of the pocket healthcare.
B.
B.
Yes, B is the right option. MCQ number seven, are low-income countries have government, the hospital, private clinic, NGOs, hospital, social health insurance, and sustained direct household expenditure. How should the system be classified? A, beverage system, B, Bismarck system, C, national health insurance system, D, pure private system, E, mixed health system.
Mixed health system. E.
Yes, yes, E is the right option. MCQ number eight, a government is unable to provide adequate diagnostic services to in the remote areas and contract private laboratories to provide these services under the government supervision. Which approach is being used? A, public sector, B, public-private partnership, C, nationalization, D, community diagnosis, E, vertical integration.
B. Public
B.
private.
Yes, B is the right option. MCQ number nine, an NGO introduced a mobile health unit and successfully reached the marginalized population who rarely attends the government facilities, which strengthen NGO is most clearly demonstrated. A regulatory authority, B, outreach advantage, C, tax collection, D, policy enforcement, E, hospital accreditation.
B.
Yes, B is the right option. MCQ number 10, a policy maker observed that Pakistan has a large private health sector, government facility, NGO, social health insurance, and considerable out-of-the-pocket expenditure. Which conclusion is most appropriate? A, Pakistan follow a pure beverage model. B, Pakistan follow a pure Bismarck model. C, Pakistan has a mixed pluralistic health system. D, Pakistan has exclusively private system. E, Pakistan has a single insurance system.
C.
Yes, C is the right option.
Thank you, Dr. Rabbia. It was a
So
very
this is
nice
the
presentation.
this is the
Thank
reference.
you so much, Dr. Rabbia.
Thank you. This is the YouTube channel where the recording of the video will be uploaded. Thank you.
Thank you very much once again, and Allah Hafiz.